Okay, it's 5 minutes after 5, and so I believe we can start. Just before we start, let me introduce Dr. Pierre to you. Those of you who have been part of Parents Roundtable discussions, I'm sure have listened to Dr. Pierre before or know her. So, but let me tell you a bit about her. So Dr. Christine Mabel-Pierre, okay, we are recording. Dr. Christine Mabel-Pierre is a child clinical psychologist with a PhD from Clark University. She completed her pre- and postdoctoral internships at Boston Children's Hospital, Harvard Medical School in 2014 and 2015, respectively. After that, she worked as a staff psychologist there. She's currently with Ghana International School, GIS, and she's the head of guidance and counseling. She's also at Mission Pediatrics, and she's head of our psychologist department. And she provides cognitive assessments, individual therapy to young people and their families. She's been interviewed by the BBC about her research on cross-cultural differences in optimal parenting strategies. In her spare time, she loves to paint, create digital art, and watch science fiction. She's also my baby sister, which is the most important. She's also my sister. Okay. So, Dr. Pierre is going to take us to childhood anxiety disorders. And somebody asked me recently, children too, do they get anxiety? What do they have to worry about that they can have anxiety? And I told the person, yes, indeed, children do get anxiety and they think about things. So Dr. Pierre is going to let us know how children can be anxious and how sometimes it may not look like the way we adults are anxious, but it's there and it's significant enough for us to do something about it. So Dr. Pierre, the floor is yours, and please take us through. Thank you.
Thank you. Thank you very much, Dr. Mabel Wilson. And thank you everyone who made the time to join us this evening, despite all our busy schedules. So this evening, over the next hour, we're going to just really delve into childhood anxiety disorders. And there is no better time than now because yes, children feel anxiety, but even more than that, since COVID, I know we always talk about COVID, but it is very much related to mental health. But since the pandemic, there's been a 25% increase in anxiety amongst young people. And so the chances that you know somebody, you know a young person or a child with anxiety are even more likely now than before. So here's what we're going to be looking at. In terms of childhood anxiety, we're going to look at what is anxiety, especially in children and young people, because it can look different. And then we'll discuss a bit, how does it even develop? Sometimes parents will ask me, but why? Why her? Why him? Did I do something? What is it? So we'll discuss how it develops. How do you know if your child's anxiety is not typical? Because anxiety, we all experience it. It's actually a very normal feeling. But how do you know when this one is a bit more and you need to see a professional or something very specific has to be done? We'll also look at how do I respond to my child's anxiety as a parent. It can be a very difficult place to be to watch your child experiencing anxiety. So what can you do to help them? And then finally, I'll talk a little bit about if, for instance, your child was referred to Mission Pediatrics to see a child psychologist like myself, what sort of treatments professionals do with children to help them manage their anxiety. So just as Dr. Marble said, we all get the question a lot. Children cry, do they feel anxiety? And the answer is a resounding yes. And it's a wide range, right? Sometimes it's just a little bit of nervousness, and sometimes it's debilitating anxiety. Everything from monsters under the bed, I think there's something under my bed, or to separation from parents, to I'm afraid of the dark, or ECG. I had a child asking me about doomsday and ECG and where is Ghana going, because they've overheard their parents talking about the economy and now they are getting very anxious about it. Armed robbers. So children here, they think they're human beings with brains just like us, and so they experience things just like us. They're mini versions of us. And just today, I was baptized in child anxiety by my own two daughters. They weren't feeling too well. And so my pediatrician said, let's take them to the lab, let's run some tests. And I thought, I've got this. I'm a child psychologist. I will prime them. I will maintain a calm demeanor. I will, pump them up. So we're driving and I'm saying, we're going to Auntie Bibi's workplace and we're going to be warrior sisters and we're going to be brave. You're going to get just a quick shot. And they are nodding. And I think it's going well. And we get there, and complete disgrace, my youngest crying, screaming down the clinic. And I'm thinking, this is true anxiety. But in about 15 minutes, she was fine. And she was happy and she was laughing. The shot was over and she was riding around on a scooter. And all this to say that as a parent dealing with anxiety, there's ups and downs. And sometimes in the middle of it, you feel like you just don't know what to do. But anxiety is an age-old issue. It's been around since man has been around. And so there's a lot of research, there's a lot of evidence on what works, and it is very possible to manage it. So we'll be going through that today. So let's start with childhood anxiety. What is it? It's a feeling, from the child's perspective, it's a feeling that something bad is going to happen. They feel uncertain, they feel uncomfortable, they feel not okay, because it's this feeling that something is not right, something bad is going to happen. They may not know why or what exactly, it's just that feeling. And it results in unease and tension. It results in a lot of worried thoughts and physical changes like an increased heart rate. For children specifically, sometimes, like I said, it looks different. So you may notice regression. You may notice that they are acting younger than is developmentally appropriate, younger than you would expect. So for instance, you may find that Kofi has started wetting his bed again. Or for younger children, they progress to thumb sucking. Or when they come home from school, the teacher will say that, oh, they wet themselves or they pooped on themselves. And you're thinking, no, I've already trained this child. It may be that they're experiencing some anxiety at school or in general, and that's causing the regression. You'll hear a lot of parents complain about difficulty sleeping, or the child wants to sleep with mom and dad. They don't want to sleep by themselves because they're having trouble sleeping, and sometimes they're having nightmares as well. Children, because they don't quite know anxiety explicitly, they will talk about physiological symptoms a lot. So first day of school, my stomach is paining me, or maybe even the first week, or I have a headache, or they might even throw up. And it's not that they are faking it. It's not that they've somehow managed to just fake feeling bad just to get out of it. They are actually feeling a tummy ache or a headache. And these are all the physiological symptoms of anxiety. And that's what may show first. You'll see crying for or clinging to their parents, especially in younger children. Avoidance, I don't want to go to school. I don't want to talk to the visitors. They may seem moody. Sometimes, for instance, if you notice your child seems very withdrawn or moody, maybe the cousins and uncle have come around and you say, won't you greet? In Ghana, greeting is very important. If you walk into a room and you don't greet, it's an abomination. And you're thinking, what's wrong with them? Why aren't they greeting? I've brought them up the right way. It may not be that they're rude. It may be that they have social anxiety and their heart is racing and their throat is dry and they're not quite sure what to do. Difficulty concentrating is another way that it often shows up in children. Some may become defiant or argumentative because anxiety is a yucky feeling. We've all experienced it and we know it doesn't feel nice. And so for children, especially if they are not recognizing that I am feeling worried or anxious, they just start to feel irritable and they might take it out on the people around them. And this will present as defiant or arguing or rude. And so they may end up in fights, they may end up in tantrums. And I've had situations where this was all based on anxiety. And it was very difficult to explain to teachers and parents that he's anxious, because to them it's like, oh, please, he doesn't respect. But we'll go into detail today about how all these symptoms show up in young people. So a little bit about how anxiety develops. It's a combination of nature and nurture. So nature being the hereditary or genetic factors. For something like generalized anxiety, there's a 30% heritability factor, right? So if your mom or dad or there's some uncle that always seemed fidgety, nervous, didn't like being around people, seemed extremely shy, then it might be something that runs through the family. And so the likelihood that the child or your child has it is higher. And usually, there's a hereditary factor if the anxiety is showing up earlier. So if it's showing up at a very young age, then there's likely a strong genetic factor as opposed to the environment. That being said, the environment affects it a lot. So I can't tell you how many times a client will come in. The primary concern is anxiety. And they're saying, please help him, help her. She's too anxious. And while we're in the session, the parent is, hey, watch out. No, come for sanitizer. You have to clean your hands. That thing was dirty. Hey, what are you doing? Stop. And immediately you can tell that the parent themselves experiences anxiety. So that's the genetic factor. But the fact that the child is also seeing these anxious symptoms all the time, seeing that there's possible danger, don't go outside, insects will bite you. There's possible danger all the time. And the way the parent is presenting it can increase a child's likelihood to be anxious. If they're getting teased a lot at school or laughed at, that will naturally increase their tendency to be anxious. Being exposed to something new without preparation. So communicating with our children is so important. But sometimes we think, oh, she's just a child. I don't need to tell her. Bam, you switched her schools. You're driving to school. You end up new school, new faces, new peers. It's jarring. And sometimes when they're exposed to something new, or sometimes even moving countries without that preparation, it can trigger an anxiety response. It's a whole nervous system, the sympathetic nervous system. It can trigger that. And sometimes once it's triggered, it's hard to get it to go back to normal. Experiencing a traumatic incident can also end up in anxiety. So if armed robbery or an earthquake or a fire or some kind of abuse, then the brain says, whoa, danger is real. Bad things happen. So we have to be hyper vigilant. We have to be aware. And so it starts looking for danger around every corner, and the child starts to develop anxiety. There's also short-term emotional triggers like losing a loved one that can, again, kind of shake the boundaries of what the child knows to be the norm and lead to anxiety. Low self-esteem, anxiety. Substances like caffeine, Coke, coffee, getting the child on edge and jittery can also transition into feeling anxious. So there are many, many, many avenues in which anxiety can develop. But how do you know if your child's anxiety is not typical? Because the truth is, fear is normal. Fear is actually good. Because imagine a child who has no fear, who, I mean, will go and stand in front of a lion and say, hi. We need to have some sense of fear, some sense of, okay, is this a dangerous situation? If so, what do I do? Do I need to run away? So fear is a good thing. And being anxious is often seen negatively. It becomes a problem, or what we call anxiety disorder, when it starts to overpower the rational thinking. So when that part of our brain that sends the anxiety signals, it's the amygdala and some other parts, if it starts to overpower the prefrontal cortex, the part of our brain that's rational, then the alarm system is always going off. So for instance, if a child is afraid to go outside, because anything can happen, what if lightning strikes? What if mosquitoes bite me and I get malaria? So anxiety is always going. And the rational part, I would say, oh, but people go out all the time and sometimes bad things don't happen, or your sisters and your friends, we go to school every day and we're okay. That part is not being as strong as the anxiety part. Then it becomes a disorder, particularly because it's going to get in the way of just living their life. The worry becomes really intense, even when there's no real sense of danger. They're very distressed, so they can't have fun. They don't want to go to school. They're not making friends. They can't finish the schoolwork. They're nervous to make a mistake. It's affecting the family. People are getting irritated. Everyone is fighting all the time. When their worry starts to get in the way, starts to impair functioning, that's when a psychologist needs to be called in. That's when a diagnosis is made, and the diagnosis has to be made by a professional, and then that's when treatment is given. So we're going to go through the anxiety disorders. There are a lot of them because a lot of people feel anxiety. And so I've listed all the disorders that are under anxiety disorder and some that are not directly under it, but are caused by anxiety. I'm just going to read through it and then we'll go through each one. There's the generalized anxiety, which is exactly what it sounds like. It's a wide range of, the child is just worried and nervous about a wide range of things. It's generalized. Then there's specific phobia, which is one particular thing, like spiders. Then there's social anxiety, which is being very nervous about social situations. The selective mutism, which is the child chooses or selects to be mute or be quiet in certain social situations. So they're not talking, but maybe they're talking at home. There's separation anxiety disorder, which is they're very fearful of being separated from their caregivers. There's agoraphobia, which is fear of public places. That's literally what it means. Fear of being outside, being away from home and outside in the open. There's panic disorders, which is fear of having panic attacks. Then there's the eating disorders, which is not directly an anxiety disorder, but usually happens because the child or the young person is feeling anxious. Maybe they feel like they don't have control of things in their life, and controlling their eating, or rather not eating, or eating and throwing up, that gives them a sense of control. So the cause is anxiety. Then we've got obsessive compulsive disorders, which we'll talk about, and post-traumatic stress disorder. So we've got a lot to go through, and I'll try and make it as conversational and quick as possible. So starting with generalized anxiety disorder. I remember someone who had this disorder once telling me, they said it's like anything and everything can go wrong. So there was a glass in front of us and they say, you see that glass of water? In my mind, it's that glass is too close to the edge of the table. It could fall. If it falls, the glass breaks, it shatters everywhere. What if a piece of the glass or the shard goes into an eye or goes into your skin? Then what if you get an infection? So the mind is constantly thinking of what if, negative, negative, negative. And it leads to excessive worry about a lot of things. So the child may be worried about school. What if I don't do well in school? What if I fail? What if people don't like me? What if my friends don't accept me? They think I'm weird. What if the light goes off and the food goes bad in the fridge? There's always a sense of anxiety. It's happening almost every day for at least 6 months. So this part is important because sometimes it may happen just for a while, especially during a transition period, right? Maybe they've just started a new school and they're feeling anxious, but it's not lasting for half a year. So for them to be diagnosed with a disorder, it goes for at least 6 months. And some of the symptoms are that they're restless. So they're very jumpy, which makes sense, right? Because if you think there's danger, you can't sit still, you can't relax. They have trouble concentrating because their thoughts are constantly going and they're worrying. And it's exhausting. They're easily fatigued. They're irritable, they're tense, and they can't sleep well. So sometimes generalized anxiety may start to look like ADHD. So sometimes you get a parent or a teacher thinking, does this child have an attention deficit? Because they can't sit still, they can't focus. But a proper interview is necessary to find out why that is, because it may be that they're anxious. So that's generalized anxiety disorder. And yes, children do get diagnosed with it. They do struggle with it. Then there's specific phobia, which I think most of us are familiar with. There may be an intense fear of something like spiders or seeing blood, you see blood and you faint, or heights. And again, it's long term. It lasts for a long time. Then we got the social anxieties. So social anxiety disorder used to be called social phobia in the DSM. The DSM is like the psychologist manual or Bible. So social anxiety disorder, the child or the individual has a lot of worry. It's excessive, it's persistent. They can't control it, worrying about being embarrassed. So it's focused on the social situations. How will people see me? And they're worried more about peers, not so much what do adults think of me, but how will my peers see me? Are they laughing at me? Will they see that I'm really nervous and, reject me? And so this leads to a fear of attending any social event. Parties are debilitating. I know a client who had trouble with boarding school. So she was moving from day school where she'd managed it. And at the end of the day, she could go home and recuperate. But now boarding school, it's constant social exposure. Whether you are waking up, you're going to class, you're coming back, prep at nighttime, you're always in a social situation. And so someone with social anxiety disorder will find it debilitating because they are always worried. They're worried about, even in the classroom, giving presentations or being called on. And social anxiety lasts for 6 months or more. It has to be longer than 6 months. And what happens is that they just avoid social situations because it gives them relief from the fear. Then we've got selective mutism, where you may have a child who is not speaking. Maybe they're speaking fine at home, but in school the teacher says, Kojo will not speak. You will call him, Kojo, do you know the answer? He just won't say a word. And it's stemming from fear. And with selective mutism, it's their coping mechanism. It's, you know what, it's too much work. It's too stressful to talk. So I'm just not going to talk. It's an avoidance mechanism, and it's reinforced because it's working for them. I'm not going to talk, then I don't feel all this fear. Then after a while, nobody's even minding me. I just don't talk. For some of them, they may have a few people that they do talk to, they don't feel as anxious with, which makes it even more confusing because they still have selective mutism, but you may see them talking to maybe like one best friend. And they will talk, usually they talk at home, but not outside the home in specific situations. Okay, then we got panic disorder. And a panic disorder is when someone first has a panic attack and then starts to worry that they're going to have panic attacks. Usually because the panic attack comes out of nowhere. It feels very abrupt. It feels, for some people, it feels like you're dying. They say that like suddenly my heart was racing, I was sweating, I was shaking, I couldn't breathe. I felt like I was choking. Some people will feel chest pain. So they may think they're having a heart attack, but they're too young usually. And so they feel chest pain. Some feel nauseous. Their tummy hurts. They feel dizzy. Some will say it felt like they weren't in the real world anymore, that it was almost like an out of body experience. So sometimes people will attribute it to something more spiritual. And they just feel like they're going crazy because why is my heart racing? Why can't I breathe? Why am I suddenly feeling all these nervous symptoms? And so when it happens once, then they start to fear that it will happen again and that they won't have control of it. And that's a panic disorder. Then we've got obsessive compulsive disorder. I think I'm making good time. Okay. So excessive compulsive Obsessive compulsive disorder is.
You have enough time, okay?
Okay, great. Am I going too fast? Should I slow down?
No, I think it's okay.
Okay, all right. OCD is composed of obsessive thoughts and compulsive behaviors. So the obsessive thoughts it's linked to being afraid, right? So not touching dirty objects, like, oh, this thing is dirty, it's got germs, and you're afraid that you'll get sick, you feel bad things happening. Sometimes it's more not to do with germs, but you need things to look right. You need the tiles to line up properly. Why is this pattern off? Or why are these pencils not arranged in the right way? So, and you're just sort of just obsessing over these little things. And then you start to develop rituals to try and handle the obsessive thoughts. So now you're washing your hands all the time because you're thinking germs, germs, germs. You know, I don't want to get COVID. I have to wash my hands, excessive hand washing, or checking the door. You know, did we lock the door? Are the armed robbers going to come again? So those are the behaviors. Oftentimes people wonder why is this child OCD? Why do they have OCD? It's related to anxiety. So if there's a family history of anxiety, then they have a higher likelihood of it. Sometimes if there was a stressful or traumatic event, this need to control what happens, for instance, checking the door to make sure that they are safe, can catapult and lead to over checking and lead to compulsions. And this one, I wouldn't say much about it because I'm not medical, but after a streptococcal infection, they have found that sometimes individuals develop OCD symptoms. So that's OCD. And then eating disorders, I think I said before, just being nervous sometimes leads, it's higher in girls, especially because there's more social messages about how we should look, and what's acceptable, how girls should look. But anxiety can lead to an eating disorder such as anorexia nervosa or bulimia. So anorexia is where they are under 70% of the weight they should be because they're not eating. And it's usually because they're trying very hard to have control over something. And they say, you know what, I can control what I eat. I'm not going to eat. Look how good I am at it. And so it deteriorates and it becomes unhealthy for them. Then we've got post-traumatic stress disorder. I believe this is the last one I've listed, also known as PTSD. And this usually occurs after the child or young person has experienced a traumatic event, or sometimes they just witnessed it. So if, for instance, there was an armed robbery and a gun was put to their head, or they were very much afraid for their life and their family's life, after everything is over, the brain is not done. The brain says, okay, we need to be ready. Anything can happen. So sometimes the person will re-experience the symptoms. Sometimes it's flashbacks. It's like you're back in the environment you were in when you were fearing for your life or you were very afraid. You're feeling just as distressed. So it's almost like your brain goes rewind. And it's not just a memory, it's like you're actually re-experiencing everything. You start to avoid anything connected to the things that trigger the anxiety. So loud sounds, anything like a car making a loud sound, or somebody slamming a door, or you can imagine in a school, random people shouting can really trigger them feeling agitated and nervous. And then they have trouble sleeping, they have nightmares, and they are feeling on edge. And sometimes this leads to angry outbursts and irritability. So unfortunately, there's a lot of negative experiences related to anxiety that our children can go through. So moving now that we've gone through the disorders, moving on to how do I respond to my child's anxiety? And I'm going to start broad and then sort of narrow into specific ways to respond, things you can say and do. So broadly speaking, if you think about anxiety as the child fearing that something bad will happen and being on edge, and this feeling of uncertainty, then you want to structure their environment. You want to take control of their environment and try and bring some predictability and routine in it. Because when there's predictability, when there's a schedule, when there's a daily routine, one, it's more calming, but two, it also teaches the child that I can have some control over things. Yes, some things are unpredictable, but I can have an effect on my environment. Because if they feel like nothing I do matters, anything can happen, that's where the anxiety comes from. But if they know, okay, I get home, I have to change out of my clothes, I have dinner, I do my homework, then I chat with mommy, then we have bedtime, and then there's consequences. You follow the rules, maybe there's a reward. Oh, I didn't do my homework, now I'm going to get in trouble at school. So they start to realize that their actions can have effect, and it gives them a sense of calmness and control. So having a structured routine is very important for an anxious child, especially if they're having nightmares or if they're having trouble sleeping. A bedtime routine where, one, you're making sure that the screens are off. I mean, ideally no screens during the week, but we all know that's very difficult. But you're making sure the screens are off at least an hour before bedtime. You're dimming the lights so that their brain is starting to associate, oh, this is going to happen, and then I'm going to fall asleep. Because if it's repetitive and continuous, the brain starts to make the association of that with sleeping. And it calms them down. The routine just calms them down. Also, communicating the expectations so that it's not, why did you do this? And then you're shouting and you're nervous because they don't quite understand what they did wrong. So make sure you're clear in communicating what the rules or guidelines are. You can put it on the fridge, discuss it with them, come up with it together. If they ask why, you give the reasons, involve them in the process. And then if things come up and they're asking, but why? Don't get defensive. Especially in our culture, we are hierarchical. So it can be, how can this child be asking me why? But understanding it helps them to feel control. Because if they say, oh, okay, the reason that I can't be on the screen before bedtime is because I'll probably have nightmares more. Then it's an easier conversation. So provide structure and routine. If there's going to be any change, prime them for change, whether it's just a transition into another activity or whether it's moving house, prime them for change. Discuss the upcoming changes, because as the mind visualizes what's going to happen, it's exposed to it and it gets used to the idea. Then there's the ways in which we talk to them. We talk to an anxious teenager, an anxious child. Sometimes in trying so hard to be there for them and to empathize, we end up empowering or reinforcing the fear. So if, for instance, they are afraid of the dark, right? And you're saying, oh, I understand. Yeah, your heart is beating very fast and you're afraid of monsters. Oh, I'm so sorry. That must be so scary. Don't do it too much, right? It has to be calm. It has to be measured. Otherwise, they start to think, yeah, it's true. Even daddy, even mommy realize that this thing is very serious, and then they understand why I'm worried. So what you do is you empathize and then you problem solve. You're calm. Imagine someone shouting and saying, calm down. Children learn by looking at you. So if you're shouting or if you're showing anxiety and telling them to be calm, it's not going to take. So you're staying calm, even if you're irritated, because an anxious child can be quite irritating, especially because the dangers are not real. So model the calmness and then teach them to manage the anxiety. So you're focusing on anxiety is a part of life. You're not trying to take the anxiety away, because by taking it away, they learn that, oh, I'm just going to I'll avoid the dark, I'll avoid going outside, I'll avoid trying to make friends. And then I don't feel nervous anymore. And that's problem solved. So you're teaching them that, okay, yes, you're nervous, but you're going to take that nervousness and still do what you want to do. So an example here is your little child says, there's a monster under the bed. Okay. One way you could say, okay, don't worry, I'll get rid of the monster for you, okay? And then you go and pretend that you touch the monster and the monster is gone. Okay, that may work, but you're not teaching them to take it on themselves. You're teaching them that you'll fix their problems for them. Instead, you say, okay, let's check under the bed together. So you're challenging their thoughts. They're scared. I can't check. Okay, what do you need? If there's a monster, we have to fight it. Go and take them up. Okay, we are ready. Let's check. So you're teaching them to, even, and sometimes it may seem ridiculous to you as an adult, but trying to put yourself in their mind, find ways to get them to be fighters of the anxiety. So with anxiety, it's a fight or flight response. It's either I'm going to face this thing and I'm going to overcome it, or I'm just going to run away because I can't deal. And you're trying to teach your child to fight it. And some of our children are very competitive. So if you use some humor and you phrase it in that way, they're more likely to take it. Where it's like, are you a warrior? Are you a thunder sister, whatever it is? Are you a fighter, or are you gonna run away from it? To try and motivate them. Okay, this one is about just communicating. Sometimes, especially because children don't always actually know that they're feeling anxious, sometimes we have to ask the questions to realize what is going on. Because maybe they're withdrawing, they say they have a headache, they say they have a tummy ache, but that's not actually what it is. Maybe they're anxious. So ask questions, listen, empathize, and ask it in a developmentally appropriate way. What makes your heart beat really, really fast? If you could wish for anything, or if you could wish something would go away, what would it be? So just every now and then, and it doesn't have to be a sit down anxiety discussion. Just when you're together, you talk about it. Second, teach emotional mind versus wise mind. So this is explicit teaching, telling children that our mind is in two ways. We have the emotional mind, the part of our mind that will always be like, oh my goodness, I'm so scared. Well, I don't want to do it. That's our emotional mind. The emotions are CEOs. They are the presidents over there. Then you got the wise mind, which knows that, okay, I'm scared, but it can also think logically. And it's almost like a lawyer, is trying to, okay, but if this, then that. So you teach them that they have two minds about everything. And sometimes emotional mind comes and takes over. And if they can realize that, then they can stop and say, what would my wise mind say instead? Or what would my wise mind do? Okay, so I'm scared of going on stage to talk. I couldn't possibly do it. Okay, that's emotional mind. Wise mind. Maybe I could do it. What if I make a mistake? It would be so embarrassing. Okay, if I make a mistake, maybe I can just say sorry and keep going. So wise mind, teaching them explicitly helps. Challenge catastrophic thinking. That's the third point. A lot of children with anxiety, they exaggerate things. So I'm never going to be able to do this. Nobody understands me. So everything is extra. Challenge it firmly with empathy, but you're still challenging. You're never going to be able to do this. You did your homework yesterday. Who did it? Nobody did it for you. You did it. So just challenge it. And it's called getting evidence, so that you're basing it on facts. And over time, they learn to do it themselves. Encourage a growth mindset. A lot of us are afraid of failing ourselves. And sometimes we pass that on to our children without realizing it, because we're pushing them, we're motivating them. And so now they're afraid to do anything and fail, whether it's fail socially, fail academically. But a growth mindset is that idea that you can learn things. You're not born smart or stupid. You can work hard and gain or achieve something that you're trying to. So failing is okay. And sometimes it doesn't feel natural, but encourage failing. Say it's okay to fail so that you can learn it and then do better. This is if you have an anxious child. You may have to, and everyone should know their child, you may have to do that, so that you're saying you're making failing a positive thing, in that you're working towards getting better. And then problem solve with them. I've mentioned that. Then we come to the more therapist type activities. In order to help the body relax, if a child is feeling very anxious, diaphragmatic breathing, it's a very simple activity that is very well researched. It has shown to be very effective simply because it's scientific. So they've realized that when we get anxious, the sympathetic nervous system kicks in, and that nervous system will get your heart beating faster. It'll get you breathing, taking in more oxygen, because it thinks there's danger and you have to act. And so if you calm yourself down, and you almost force your breathing to be calm and measured and slow, it sends a message back to your brain that, oh, I guess there's no danger. Maybe we're okay. And then it helps the sympathetic system to relax and calm down. And so diaphragmatic breathing is simply breathing in through your nose, into your stomach or into your belly, and then out through your mouth. And with little children, sometimes you can use bubbles to teach them. So the bubbles that you can buy China Mall or by the roadside, and you teach them to breathe in through their nose and then blow and make the bubble. And you say you want that bubble to be big, because to make big bubbles, you have to breathe in, you have to breathe out really slowly to get the bubble not to pop. So practicing belly breathing, ideally you should practice it when the child is relaxed, not when they're actually anxious, so that they get used to doing it and they can use it when they're anxious. Then there are some children who they need the energy to come out. So I remember I had a client who I tried to teach him belly breathing, and I mean, I made it so much worse, because he was not the type to sit and breathe. He needed that energy, that negative energy, to come out because he was so tense. And so an alternative is a progressive muscle relaxation, where they are tensing and relaxing different body parts. And sometimes for young children, it might actually involve like punching a pillow, right? It's designated, it's a safe space, but they need to let that energy out. So progressive muscle relaxation, sometimes you'll use metaphors like pretend your body is uncooked spaghetti, and then now pretend it's cooked and it's all relaxed. And it's just teaching them to work from the outside in and to relax their body and their muscles so that their brain will relax as well. Then there's mindfulness exercises. An example is the 5, 4, 3, 2, 1. And it's almost like a distraction method. So with this exercise, it's tell me 5 yellow things you can see, 4 things that you can hear, maybe 4 loud noises you can hear, 3 things that you can feel, whether it's the seat under you or the breeze on your skin, 2 things that you can smell, 1 thing that you can taste. And so by the time they finish 5, 4, 3, 2, 1, they've focused on their surroundings and they're not giving their negative thoughts as much attention or value, and it calms them down. Then there's also visualization. Some children will have vivid imaginations, and you can use sort of thinking either to a past happy memory or even an imagined one where they're going through all the 5 senses, what they can see, what they can hear, what they can smell, what they can taste. For some, it's the beach. For some, it's dinner at grandma's. But they learn to visualize it. Their mind associates it with relaxation, so that when they're tense, they think about it, and then the mind goes into relaxation mode. So these are some of the relaxation strategies available. Then there are others. I mean, there's counselors, and often you would have a discussion. So never assume you know, right? Usually even though they're children, they are experts of their own emotions and what helps them calm down. So for some, it's exercising. I had a 16-year-old boy who was experiencing a lot of anxiety, and he discovered that if he exercised in the morning, if he gymmed in the morning, for the rest of the day, he was a lot calmer. So sometimes it's just letting out the extra energy. For some, it's art. For some, it's just talking, having a social support system, talking to people. Self-reflection and journaling can be very helpful, especially for those with the catastrophic, everything is doomsday type of thinking. It helps them to change their perspective gradually over time. And so some of the things I've talked about, a professional will do in therapy. But this last slide is about some of the approaches we take in therapy with a young person. So there's behavioral therapy, which is exposure to the triggers. sometimes with OCD, especially, there's this idea that if you can expose yourself to the thing that is making you uncomfortable and you're fine, then your brain learns that you will be fine, even though it's uncomfortable for a long time. And so exposure therapy has been shown to really, really work. And sometimes even at home, you can do it by just sort of imagining and talking about it in a safe, calm space. Then there's cognitive behavioral therapy, which combines the way you think to what you do and how you feel. So the beginning of it is teaching the child that what you do, what you feel is linked to what you think and do. So it's a triangle you draw. Sometimes you have a body silhouette and they'll show you how they're feeling. Maybe they feel red in the chest because the chest is tight. They're feeling anxious or angry. And that connects to what they're thinking. They're thinking, oh my goodness, everybody's going to laugh at me. And it connects to what they do. So then you show them that if you can change what you're thinking, right? Because that one is just decision. You can think, oh, maybe they're not laughing at me. Maybe they're smiling and saying hi, they're being friendly. It's possible. Then you can change how you feel. So we do a lot of drawing with children, a lot of talking with the older teenagers, a lot of talking and hypothesizing, is that a word? Going through hypothetical scenarios. And a lot of it is about learning about yourself, knowing what your triggers are, what your cues are, and then finding thoughts that are more helpful for you. And usually by the end of CBT, by the end of this therapy, you have a toolbox. These days with the teenagers, it's usually on their phone and some folder on their phone, and they have their strategies that they will use when they are in the red zone, which is like highly, highly distressed, or when they are in the yellow zone. And then there's also medication. I've seen amazing effects of medication, especially with some of the disorders like selective mutism. It's hard for the child to push themselves up and out of it, but the medication helps them. And then they're able to use their behaviors to get out of it. And then for some situations, eventually wean themselves off the medication. So that's it for the strategies. Other considerations: keep children out of marital problems or financial problems. Sometimes this is the cause. Sometimes when they are treated as adults, or if they're not separated from some of these tricky conversations, they're children. They're not supposed to be exposed to it. And so it starts to cause anxiety. Use your network. If you have some cool sister or cousin, some favorite aunt or uncle that can talk to them instead of you, sometimes they would say exactly the same thing you've been saying, but just because it's coming from that cool aunt or cousin, your child will be more likely to take it in. So use that. It takes a village to raise a child. Don't feel like you have to be the one to do it all. And then create space for the informal conversation so that they feel like they have your support and they can come to you during difficult times. So that is it for this presentation. Anxiety is tricky, it's yucky, it's ugly, but it is manageable. You can make the best of a bad situation. And people who have learned to manage their anxiety sometimes are, the most calm and zen people, because they know what it's like to be on the other side, and they've worked at becoming mindful and relaxed and wise. So it's a journey, but it's definitely doable. So that's all from me, Dr. Marvel.
Thank you. Thank you very much, Dr. Pierre. Wonderful as always. Let's answer some questions. We have some comments in the chat box. Let me start from the top. So Debbie says, which of this disorder does the constant pulling of hair, trichotillomania, fall under? And how can I help my child other than keeping a clean shaven head, as he
Mm,
also pulls on his lashes or eyebrows?
okay, good question. Yeah, so that's also that's also a difficult scenario. So with all of these, with trichotillomania, again, the approach is to give them a different way to cope, right? So keeping a clean shaven head is a good start. But when the child gets, whether it's anxious or angry, and they've got that energy that needs to come out, they need to do something. And so they are pulling on the hair, sometimes just out of agitation, sometimes because the pain is actually distracting. The trick is to find a different coping strategy that will work for the child. If they are very energetic, maybe it has to be like a punching a pillow or throwing a ball really hard against the wall, something to release it. For some of them, I've had clients who realized they weren't able to communicate what they were feeling, and so they were, and so sometimes you can use communication cards. And again, this is something a psychologist or an OT can help with, so that if verbalizing is too difficult when the emotions are so strong, they can like point to their communication card or just give it to you, or sometimes use a code word. That has worked before with a family where we just came up with a random code word. It didn't mean anything. It was something like lollipop or popsicle or something. But once the child said it, everybody knew, okay, they're really, really upset. Let's just stop and listen and try to understand. Uh, so bottom line is, what can we give them or teach them so that they have an outlet for all that negative emotion?
Thank you. Thank you. Next one says, one of my children is fidgety since or has been fidgety since she was a baby. I wonder whether experiencing something traumatic during pregnancy can cause the baby to be this way, and what can be done to correct this or keep it under control.
Hmm. So there is a correlation. And this one I'll ask please my psychologists who are on here or any of the team from Mission Pediatrics if you can chip in. So there is, let's see, it's fidgety.
Yeah, since
So
was
it's
a
just
baby.
fidgety. The fidgety could come from a number of different factors. See, sometimes we get children who are hyperactive, and so they come across as fidgety, but it's not because something negative has happened. It's more because the brain can't focus for long periods. And so they're always changing sort of what they're doing. There are cases where if the fetus experiences trauma, they come out more clingy and more anxious. So I would say it's important to find out the source of the fidgety
Mm-hmm.
um, before coming up with any solution. Because
Yeah.
if it's not the right one, then I mean you won't be helping the child.
Okay. Agreed. I also agree that it could be a varying range of things. So it's very difficult to say with just this information. But again, some children are fidgety and have full of energy, and it doesn't mean it's a bad thing.
Mm.
So if he's fidgety at school and his school is handling him well and the home is handling him well, it's not all children who have to sit down quietly. Some have to fidget. It's
Mhm.
the spice of life, I always say. Some have to move. So I think we'll have to get more information on this one and see whether it's a reason to worry or it's just a variety of life. All right. Um, okay, I have some comments. Wow, dealing with children is work and I'm learning indeed. What steps do I have to take to become a clinical psychologist after medical school? We have a medical student who also wants to be a clinical psychologist.
Mm.
Any idea what she has to do?
If they've already gone to medical school, they could specialize into psychiatry.
No, she wants
Right.
to be a clinical psychologist. Also,
So
like,
this is actually it's quite difficult because a lot of them make you start over. They make
yeah.
you start from scratch. And even the master's level, some require that you did psychology first degree. I have found one program at Lehigh. It's an online program in the US at Lehigh University that will give you a certificate for, it's not clinical psychology though, it's educational psychology.
They could ask Dr. Ama Edwin and our own doctor in 37, Erica. Both
Yeah.
are medical doctors and clinical psychologists. I'm sure they would have more to say on this one.
Are
But
they
it's
on here?
possible. No, I haven't seen them.
Okay.
It's possible. Now, please contact me. I'll find out for you. Or if you know Ama Edwin or Erica Dixon at 37, please see them. Thanks for this presentation. What are the classic signs of anxiety disorder in a child? I think that's right. But if you can briefly.
So usually it's the thoughts. The classic signs are these pervasive negative thoughts or worried thoughts of something bad is going to happen, or this is not going to work out. And so they will be expressing that quite a bit. Then you'll also see, sometimes it's easy to see in terms of the psychosomatic symptoms. So my stomach is hurting or my head is hurting. If it's intense, you'll actually see them like actually trembling, right? When they're in front of the trigger. Trouble sleeping tends to happen a lot because children have that active imagination. And so at night time, when everything is quiet, that's when their mind goes a bit wild. So those are some of the classic signs. But I think the slides have all the things listed, the restlessness. Every child is different. So it really just depends on the child.
Okay. I see some hands raised. Please permit me to finish the questions in the chat and then I'll call you guys. Okay. Oh, please mute your mics for us. Thank you. Godfrey, can you find out where the noise is coming from and mute it for us? Thank you. All right. Somebody's asking if these relaxation strategies can be applied to adults.
Definitely. I use them all the time.
Okay, great.
Yeah.
All right. My daughter has been complaining of headache, stomach pain. Several investigations at the hospital usually doesn't come out with any positive clinical results, but she can even cry. There's no question to this though.
Yeah, so I would say they should see a psychologist to see whether it may be a psychological cause.
Okay. All right. We have lots of questions. Thank you. Please, what is AHAD?
I think that was ADHD. I put it in the slide and it was attention deficit hyperactivity disorder. So that's a disorder where the child has trouble focusing for long periods and they are hyperactive. And so I was saying that sometimes that trouble focusing or being hyperactive, people think that's what's going on, but actually the child is anxious.
Okay. Can being overprotective lead to anxiety disorder?
Yeah. So when the child sees that the parent is concerned or anxious about a lot of different things, and sometimes the parent is giving reasons for why they are overprotective. So they are stating all the negative things that could happen. Right, a car could hit you, or you could die if you do this. Then they start to become anxious of thinking of all the negative. And if it exacerbates or if it escalates and it's not managed, it could end up getting in the way of them living the life they want to live, which is the disorder.
All right. Should I be worried if my child finds it a lot more comfortable confiding in another person who isn't even a family member when faced with anxiety and other life stresses? How will I handle such a child if that's one person they like to confide in is not in town or is no more and they
Mm.
are facing the challenge?
So don't be worried at all. I've actually had a young person tell me that because they valued their mother so much, there are some things they didn't want to tell her or open up to her about because they just valued what she thought of them so much. So it's natural for them to, especially as they get older, um, they separate. They're supposed to separate from parents and move more towards others, including peers. So don't be worried. The problem is if the person is not in town, they can do video chats. It's very possible. There's even things like e-therapy or virtual therapy. So if it's just talking to the person, I've had some children almost do better texting than talking face to face because they're able to process their emotions better in text. They're so used to texting these days. So try the virtual methods. If the person is no more,
well with you guys.
was that a question? If the person is no more, my sincere condolences. Um, but try to find somebody else.
Okay.
I don't sort of force it on them, but gradually see if there's anyone else that they would be willing to talk to.
Good, good. Thank you. Is there a right time to scold a child? In terms of age, I feel below 4 years, scolding can get them to have
Uh,
these anxieties. Any insights, please? So this person is asking whether if you scold a child, it can push them into anxieties,
mm,
especially the young ones.
yeah, I think it's all about the how, not the what. So you can scold a child very calmly. In fact, there are some parents that are so calm and scary, right? So it's that the loud sound and the shouting that can aggravate the child and make them anxious. But if you're telling them, what you did was so dangerous and I'm so disappointed, and then you have the consequence. Because a lot of us make the consequence shouting, which is a lot of work for the parents. If every time your child does something, the consequence is that you shout, 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 then it's over. If you have an actual consequence, like, okay, no TV for this week, or you have to do the dishes until next month, have an actual consequence for the negative behavior, then you save yourself the shouting, and sometimes it's even more effective.
Excellent. Thank you. May I add that
Mhm.
children are very robust and actually strong and and scolding and consequences I don't think would push them into a disorder if
Mhm.
it is done with the right heart and in the right way. Okay.
Yeah.
Um please, great session. Dr. Kilber says great session. Thank you.
Thank you.
Please, under which of the anxiety disorders does a child who refuses to write in a book but would rather write on the wall fall? And how can such a child be helped? I don't know if it's under
This may
anxiety
be a
disorder.
conduct issue
Yeah.
or defiance. Find a board for them. They refuse to write in a book. The wall is nicer. It's bigger, white background. Maybe
Yeah.
put a nice board on the wall.
Yeah.
Um, how can they be helped?
Yeah.
There's nothing new under the sun. It's the consequences. The find an alternative for them because the drawing on the wall is expressive. So you don't want to cut that off. So let them draw somewhere else. Maybe they like
Yeah.
the white background. Maybe the book is too small. There are also
Yeah.
some children, depending on the orientation, it's easier It's easier for their brain to process what they're doing. So see if they can use a board instead. If they do write on the wall, punish them. A good one is making them scrub the wall. Get the soap and water. Even if they're 2 years old, they can scrub the wall. It teaches them that if I do this, I'm going to have a lot of work to do.
Yeah. I must say it's not an anxiety disorder though. Children like to write on the wall. And writing in exercise book, seriously, is not interesting. I've always said, I mean, white paper with gray pencil is not interesting, especially for kids who are now learning to write and who want fun and excitement. So we have things like pre-writing skills where you learn how to write with sparklies and color painting. You write on a stone, you write in the sand, you write in colored gari, those things. Try and do those ones first. And once the brain knows how to squiggle the A's and the S and everything, then transferring to the boring paper is not as difficult. But starting to write on paper is not interesting. Okay. My son tugs on his shirt all the time. Please, is it a sign of anxiety disorder?
So with issues like that, it's good to see the antecedents or the thing that happens before they start doing it. It gives you some information on context. Is it all the time? Is it when they're in front of people? Is it just at school? Because tagging on the shirt could be, again, it could be just a fidgeting. It could be a sensory thing. Maybe the tag at the back is worrying them. But if you can sort of analyze and see if there's any pattern or consistency in when they're doing it and what causes them to stop, then you get a better sense of why.
Okay. Thank you. My child is always coming back home with bruises. That's indicating being bullied in school. Teachers are saying they have no idea because the bruises aren't from them. And the child isn't communicating effectively or not communicating at all. How is his or her day? Oh, I'm sorry. The child is not communicating how his or her day in school went to help ascertain who is bullying them. How do I fix this? So this child is
Very
having
serious.
this and they can't communicate, and the teacher said they have no idea how the bruises happen, which is preposterous though if it is consistent.
Because once you leave them in the school is responsible for their safety.
Exactly. So if it's consistent and teachers can say they have no idea, it means that supervision is not great. And our advice for you to, I've taken over, KK, sorry.
Oh, that's fine.
No, that's fine. Advice for you to go to the school and have a heart to heart. And if it's not working, please find another place for your ward.
I think they can also ask for a meeting.
Yeah.
Sometimes it's when you're just talking to the teacher one-on-one, it's not taken as seriously if you ask for a meeting where maybe the teacher and the principal or head of section and then have a face-to-face conversation that this is the issue. How can we problem solve together?
Yeah. Okay. Thank you. If the child should be communicating, I'm not sure what age, but if this child has communication issues, I hope you are also tackling that because communication delays can get them frustrated and then they can get into fights and things when they can't communicate, and then they can get aggressive also. Okay. My girl is 9 years. My girl at 9 years always wish that daddy travels so she comes to sleep with me in my room or bed. And so if daddy comes back, she gets worried. Where do I place this one?
That's an anxiety. Sometimes as transition object or security objects can help. Like a giant teddy bear or a blanket they like.
Okay.
So they have something. So a nightlight.
Okay. So on the trichotillomania question, so it seems that he does it more as a soothing activity. This child has Down syndrome, and there's no aggression or being upset while he does it. Mostly hums, not to any particular tune, while rocking along and pulling the hair.
Oh, I see.
So this is definitely no anxiety.
No,
it's a
it's
stereotypical.
a sensory.
A sensory, yeah. It's a sensory and a repetitive behavior. But I'm thinking the distraction and will still work, or?
Yeah, distraction, something alternative you can do.
Yeah. So give him something alternative to soothe him.
But what's my
My daughter always comes home complaining of headache. When I ask her to relax or sleep, she tells me it's gone. Should I be worried?
When she's told to sleep, then she says it's gone.
Yeah, so when she sleeps, then it goes.
Oh, okay. Yeah, so it could be a stress headache or an anxiety headache. So a conversation, ask her, the things that stress her out, depending on her age. Things she likes, things she doesn't like. I always give this example of highs and lows. When they come home, what was your high for today? What was your low? It will give you an idea of what's going on in school.
Okay, we have lots of questions, so they keep coming. How
we
do
have
you
till 6:30? Oh,
yeah, let's go.
Okay.
How do you support a child who does not speak in school or speaks very little but speaks fine at home? So this sounds like selective mutism.
Yeah. So they need a therapist. But some of the things you can do is play dates can be helpful. So it's almost trying to bridge the gap between home and school. If there's one child in the school that they like, that they would be less anxious talking to that person if they came over, then it's a place to start.
Thank you. But as it says, for selective mutism, you really need to go professional with that, because it can persist if you don't do things about it and gets harder. Okay. Wonderful presentation. Thank you. Very insightful. How do I manage a child who throws things around or destroys things when anxious or angry and says, I'm nobody's friend?
A behavior plan we have found can be very helpful. So picking target behaviors. What is it that you want to see the child doing? Maybe you want them to practice a breathing exercise, or you want them to practice telling somebody, I feel mad because you did this. So you outline the behavior, and then you have a chart: Monday, Tuesday, Wednesday, Thursday, Friday, and you're charting whether or not they get a gold star if they were able to do it even once. What it does is, especially if it's a visual chart, they can also see. It helps them understand what the grown-ups are trying to do. It gives them something to work towards. And then if there's a reward, and coming up with a reward, if they're old enough, do it with them so that it's something that they actually want.
Okay, thank you. There's a suggestion about children writing on the wall. So for the child writing on the wall, you can get black acrylic paint and paint a designated part of the wall and have the child write there with colored chalk.
That's nice.
So that's a suggestion for you. Is fingernails biting a sign of anxiety?
It can be, but it can also just be almost like a sensory habit.
A habit. So, okay, so it can be. So we have some questions from Facebook. How can you help a teenager with exams anxiety?
Okay. With exam anxiety, Preparation helps. Visualizing where they are going to take the exam. So sometimes I even tell the student to go and study in that classroom and picture, the invigilator standing there. And so their mind is being exposed to it. They should avoid being around everybody right before the exam, because that's when all your peers are saying, hey, did you study this part? Do you remember this? And that can increase anxiety. So they should find a quiet space before the exam where they can calm themselves down. During the exam, they should have a way to calm themselves when they start to panic. Breathing is the easiest. You can do it anywhere, everywhere. You're just focusing on your breathing for 60 seconds. And then when you're done, you do what you can. So these are some of the ideas. There are others that a psychologist can help the child come up with. Sometimes they come up with sayings or some lyric from a song they like that they're using to motivate themselves when they're starting to panic.
Okay.
So those are some of the ideas.
Thank you. Thank you. Thanks for this educative presentation. Thank you, Winifred, for encouraging us. Somebody has a girl who is 5 years and will not sleep when the lights are off. She'll wake up in the middle of the night and want to sleep in the parents' bed. And she'll tell them she's seeing things, monsters. And the last part I can't read, something about do we believe or not to believe?
That is real monsters.
Yeah.
I always say there's no harm in attacking it from all angles. You see, so yes, go ahead, do the praying, but also do some of the cognitive psychological strategies. Because children do have active imaginations. So you don't have to pick one path. Do all. With the monsters, a lot of it is challenging the imagination. With one client, what we did was we turned each imagination into something funny. So she would come up like maybe she's seen a scary spider, and then we pictured the spider with the clown face, and it was looking so silly. So we were using her imagination to change the scary monster into a very silly thing. And over time, she kind of realized that it was her imagination doing all of it. So tackle it from every angle.
Thank you. Please also find out if she's watching any scary stuff and try and take out scary stuff from there. Okay. Great presentation. Yes, the recordings will be available on our Facebook page. Thank you for a very insightful presentation. Thank you too. There's another question on selective mutism, which seems to be coming up a lot. How can I help a child who will not talk in public no matter what, but is very talkative at home? I think you said quite.
Come and see us.
Yes. yes. So I think just to if you didn't hear what Dr. Pierre said initially, he said you could get a play date, somebody he's comfortable with, and start with that and then graduate. But definitely please come and see Dr. Pierre to help. We have a couple of clients like that. They are doing very, very well now. Okay.
And then helping them with the calming down strategy. Because it's anxiety, if they can find an effective way to lower the anxiety, they may be able to. And then you have target behaviors, like maybe it's just hello. So for this week, let's see if we can say hello to one person, even if they don't respond or they don't hear you. So you're gradually building up the targets.
Excellent. Thank you, Alfred. Alfred says that's awesome session. Thank you. Somebody at age 26, he says, at my age at 26, I'm still afraid of my father. I can't tell him my problems even when I really want to. And this problem is faced by my other siblings too, even the married one. He yells about everything. His idea on how to discipline children feels simply outrageous for me. I don't feel safe emotionally in my own house, more like a stranger. And there are certain challenges I face. I need a man's opinion. We are all girls, no brothers. Oh, how can I help myself and my siblings?
That's very difficult. I
Yeah,
always say family is the one wild card. We can pick our friends, we can pick a lot of our hobbies, but we can't pick who we end up with in terms of our home environment. I would say look wider. It may not be daddy, right? It may be somebody else, but be very careful to who you're approaching for advice. But it may be maybe an older person in the church that can give you the advice. It doesn't always have to be a family member, unless it's that you need permission for something, then that's different. But if it's just advice, um, there are people. If you look closely, you'll find people in your life who can help.
thank you. If this is affecting you a lot too, please come and talk to somebody. Talk to a counselor in church or come and see one of the psychologists to see how you and your siblings can be helped. And maybe daddy can also be helped. We never know. Yeah.
And sometimes they do what they grew up with, so they
Yeah.
don't know any other approach.
Yeah. Yeah. Okay. Oh, okay. I think the rest are comments on how wonderful and insightful this presentation has been. I agree
Thank
totally
you.
100%, Dr. Pierre. Um, are there any hands up? I saw Hannah. Is it Hannah's hand was up? And Debbie. Debbie, if you still want to ask a question, we'll take maybe two more questions before we wrap up since it's 6:32. Or if you've already put your questions down. Debbie.
Yeah, thank you. I was just providing additional information about the hair pulling. But I think provided that I have always suspected it could be a sensory issue.
Yeah.
So you say that the sensory issue, probably I would now explore ways to distract him because it really gets in like boring for me.
Yeah.
Yeah.
Yeah. Okay. Thank you.
Thank you.
If you haven't seen OT could also help in that regard if it's a sensory issue, and look for something else for him to do to replace that. Yeah.
Okay, we'll do that.
Sometimes
Okay.
all these gadgets that we have these days, the puppets and the bubble wrap and the stress balls, it may be able to substitute that tug, that feeling.
Yeah.
I get it. I'll look for some. Thank you very much.
Okay. And then I saw somebody else. Was it Hannah or somebody's hand was up? Okay. If nobody's hand is up, now I'm sending you my contacts. Please contact me on WhatsApp so I can send you Dr. Dixon and Dr. Amma Edwin's number. So that we can get some more clinical psychologists, doctors in the field. Okay. All right. Thank you so much, Dr. Pierre. It's been a really wonderful and insightful, educational, awesome presentation. We are very grateful that you were able to make it. As we said, Dr. Pierre is our head of psychology department. We have wonderful other psychologists at Mission. We have Ethel, we have Nora, Erica comes to help us sometimes. Jifa, who has run away, but we have a lot of
she's gone to Canada to get more training.
Run away to do further studies. But we have lots of psychologists who do all these things that Dr. Pierre has talked about: cognitive assessments, cognitive behavior therapy, individual therapy, ADHD strategies, everything you can think of. So please holler us if you need our help, and we are always ready and willing to help. Next month August will come up again with very exciting topics and seasoned speakers. So make a date with us next month at Parents Roundtable discussion. Today we had almost 150 plus of people, and some also joined us at Facebook. So that's really encouraging. If you have family members you know who will benefit from these educational topics, please share the links with them when it is time. Last announcement, we have our special education and inclusion webinar. This is the second edition coming off in August, all the weekends in August, Saturday, Sunday of all the in August. And we're going to have wonderful seasoned speakers talk about education and how teachers can include all learners in the classroom. So please look on our Facebook. The flyer is on the page now. Look on the Facebook, and if you're interested, or if you think your ward's teacher will benefit from this, please let them register and catch the early bird registration. The special feature for this inclusion webinar would be that we'll be having breakout sessions. Last year, we had all these wonderful speakers, but the time wasn't enough and people wanted to ask more questions and actually do practical stuff. So this time we are going to have breakout sessions after every lecture where you have other moderators who can answer all your questions and actually take you through the nitty-gritties of the topic. So please make a date with us and share with other educators. This is for both educators and parents and anybody in the education sector. Thank you very much and see you next month. Bye-bye.
Bye.
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 God bless you.
Thank you. God bless you too.
Bye. Bye. Bye.
Bye. Bye-bye.
Bye.
Bye. The link to the recording has been put there. So those who are still here, if you need a link to the recording, it's on the chat page, or you can check the Facebook too.